Talk about Michael Jackson's medical mystery and why some people still think he's alive today. So back in 2009 in LA, the police got a call that Michael Jackson was unresponsive at 50 years old in his mansion.
We're trying to pump him, but he's not.
Okay.
So instantly, this was the biggest news out there. There were people swarming Michael Jackson's mansion as well as the hospital. Investigators had to get to the bottom of why at the age of 50 years old, Michael Jackson was no longer alive. So way before this, Michael Jackson had a common history of having trouble sleeping. He tried multiple different sleeping medications, pretty strong prescription ones as well, and he felt like none of them really worked. Well, one time when Michael Jackson was at the dentist, he was put under for a procedure with a drug called propofol, and he really liked it. He really wanted to be able to use this to go to sleep because it knocks you out, and it's really only used in surgical settings. So this desire, on top of being a superstar that travels the world, Michael wanted to have a personal doctor that followed him everywhere, and this is where Dr. Conrad Murray comes into the picture. So Dr. Murray transitioned from being a cardiologist into being Michael Jackson's full-time doctor. Financially, Michael Jackson treated Dr. Murray very well. He got paid $150,000 a month, which is $1.8 million a year, and that is on average 4 times as high as a regular cardiologist. Along with this, Dr. Murray was giving Michael Jackson propofol, that drug from the dentist that should really only be used for procedures. So this is very dangerous because 20 out of 30 nights a month, Michael Jackson was being put to sleep with something that's used in surgeries. And in fact, in Michael Jackson's mansion, he had what was called the treatment room. And literally this entire room was dedicated to help him going to sleep with this surgical anesthetic. Random side note, when they searched his room afterwards, they found a bunch of pictures of random baby boys, and some found this to be peculiar because of all of the allegations he had in the past. So right after Michael Jackson died, when investigators went in the treatment room, they noticed things all over the place, like saline bags, syringes, a bunch of stuff, and then they caught one bottle on the floor of propofol. And this completely changed the investigation. So on the mansion security camera, right before Michael Jackson died, they saw Dr. Murray walking in with a big medical bag. Basically, Dr. Murray lied about how much propofol he gave Michael. He had so much in his system. And then he also lied about where the medical bag was. They had to hunt the entire house down, and then they found it hidden away up in this cabinet, and in there was so many shooting guns, including a bunch of trash, like multiple things like empty bottles, syringes. Investigators basically came to the conclusion that while Michael Jackson was dead after Dr. Murray gave CPR, that he most likely just tried to clean up the entire mess and got rid of all the bottles so that he wouldn't get caught. In court, Dr. Murray was facing charges up to second-degree murder and life in prison, but he ended up getting charged with involuntary manslaughter and 4 years in prison, and he's now out. In the next video, I'll talk about why people still think Michael Jackson's alive.